One of the most common questions that we get early on from patients after a diagnosis of MS is, well, should I change my diet and what should that diet be? And I've read online, okay, there's this diet, that diet, and I'm confused. Whatever is good for general health is actually good for somebody with MS. A healthy diet in general has other benefits. So of course, if somebody has a healthy diet, they tend to avoid the cardiovascular risk factors that we think about. So diabetes, high cholesterol, high blood pressure, which we know are things that can lead to MS being worse. I think that there's enough data to recommend a kind of a heart-healthy diet. A lot of people recommend the Mediterranean-style diet, which is high in fatty fish, fruits and vegetables, high in fiber, low in things like red meat, trans fats. So beyond the Mediterranean diet being considered sort of as an example of an anti-inflammatory diet, it can certainly improve overall kind of energy, fatigue, and sleep. I think it's always important to have open communication with your neurologist, with your primary care physician, of course, and sometimes it's also helpful to involve a registered dietitian, nutritionist, to go through these different factors with them.